Hello and welcome to Lyra Nara. In this video we are going to talk about depression. We're gonna discuss the different types of depression, the relationship between depression and what happens in your body, so how it affects your whole organism, the organs, and of course also propose some natural solutions that will help you with your depression. Before we do that though, one quick reminder, take advantage of our limited time only sales action at lyranara.com and get some of the most amazing holistic health devices that can also help you, for example, with your depression at unparalleled prices. Also, if you enjoy this type of content where we talk about holistic health solutions, like, share, subscribe, comment, and hit the notifications button. It really helps us out. So without further ado then, let's learn more about depression and what we can do about it. Depression is, as we all know, unfortunately nowadays a very common and serious medical condition that negatively affects how you feel, the way you think and how you act. It causes feelings of sadness and/or a loss of interest in activities you once enjoyed. It can lead to a variety of emotional and physical problems as well, and can decrease your ability to function at work and at home. And depression symptoms can vary from mild to severe, and they can include feeling sad or having a depressed mood, a loss of interest or pleasure in activities you once enjoyed, changes in appetite, weight loss or weight gain that is unrelated to your diet, trouble sleeping or sleeping too much, a loss of energy or increased fatigue, increase in purposeless physical activity, for example, hand wringing or pacing or slowed movements and speech, feeling also worthless or guilty, difficulties thinking, concentrating or making decisions, thoughts of death or suicide. And also, interestingly enough, depression is more common in women, though the gender difference diminishes with age. And many hormonal factors may also contribute to the increased rate of depression in women, particularly during times such as the menstrual cycle changes, pregnancy and postpartum, miscarriages, premenopause and menopause. Men with depression typically have a higher rate of feeling irritable, angry and discouraged, and this can make it harder to recognize depression in men. The rate of completed suicides in men is 4 times of that in women, even though more women attempt suicide. Let's discuss then some of the primary causes of depression. Because depression is not, as often believed, a chemical imbalance in the brain. Depression is generated from the right temporal lobe of the brain as a result of the specific psycho-emotional shocking event or a whole bunch of shocking events. A right-handed male with a normal hormonal status and a right-handed female with a low estrogen status become depressed when they experience a so-called territorial fear conflict, a territorial loss conflict, a territorial anger conflict, or a territorial marking conflict. A left-handed female, with a normal hormonal status and a left-handed male with a low testosterone status become depressed with a scare-fright conflict, a sexual conflict, identity conflict, or a marking conflict. In case of a temporal lobe constellation, which is known as manic depression, both right-handers and left-handers are depressed when the right hemispheric conflict is dominant. And depression manifests as a low mood. A depressed person is passive, introverted, and listless. Depending on the intensity also of the conflict, the condition ranges from a persistent feeling of sadness to a severe depression with debilitating effects on the person's well-being. A light depressed mood, however, has definitely its favorable aspects since it opens a space for deep introspection and for creativity that differs from the vivacious productivity of the manic state. Artists, for example, always have drawn from this productive melancholy to create some of their greatest works. In children and teens, a depressed mood is in today's psychiatry considered a symptom of ADD or attention deficit disorder, and we will soon talk about this in a special video. Depression is also often associated with mania, and therefore we will address also the manic depressive behavior and manic behavior in a special video. Let's discuss, however, already in this video what causes primary mania. If the psycho-emotional trigger affects the left temporal lobe, then that person becomes what is known as manic or manic depressed. To differentiate between mania and depression and manic depression, we use the terms primary mania and primary depression. In psychiatry, mania and depression are classified as unipolar mania and unipolar depression, to be distinguished from bipolar disorders. A right-handed female with a normal hormone status and a right-handed male with a low testosterone status, they become manic when they experience a so-called scare-fright conflict, sexual conflict, identity or marking conflict. A left-handed male with a normal hormone status and a left-handed female with a low estrogen status, they become manic when they experience a territorial fear conflict, a territorial loss, anger or marking conflict. In case of a temporal lobe constellation, so manic depression, both right-handers and left-handers are manic when the left hemispheric conflict is dominant. Mania manifests with an elevated mood. A manic person is active, extroverted, dynamic, energetic, driven, overly excited, euphoric, and full of vigor. If the underlying conflict is moderate, a manic state can be highly beneficial, as it raises the energy, heightens the mood, and increases a person's efficiency and productivity. People with a mild or moderate mania are generally in a happy and cheerful mood. Severe mania, however, can consume a person due to the lasting intense stress and sleep deprivation. In children and teens, a manic, so an overactive and impulsive behavior, is considered in today's psychiatry as a hyperactive disorder and is related to a motor cortex constellation. Left-handed woman with a normal hormone status and right-handed woman with a low estrogen status, so postmenopausal, woman on birth control pills, pregnant and nursing woman, woman on estrogen suppressing medication, and women who had their ovaries removed are more susceptible to suffer from depression. And we do offer thus an explanation on why far more women suffer from depression than men, and why depression is a common side effect of contraceptives. Also, when a woman starts taking the pill or enters menopause, a female conflict such as an identity conflict or a sexual conflict might turn into a territorial anger conflict or a territorial loss conflict. Thus, the same conflict situation that made a woman manic makes her on contraceptives or after menopause depressed. The healing phase of primary mania is that after the resolution of the conflict, the person is no longer manic but feels rather tired and lazy. The healing phase of primary depression is that the agitated depression sympathicothonia, so the conflict active phase, changes into a relieved depression, a vaugotonia phase. The two types of depression are, however, of considerably different quality. While the agitated depression during the conflict active phase presents as restlessness, nervousness, irritation, racing thoughts, and difficulty sleeping, throughout the relief depression, so the healing phase of the conflict, the person is extremely tired and sleeps excessively, also known as hypersomnia. Prolonged conflict activity, relapsing conflicts, as well as a prolonged healing phase leads to a chronic long-term depression called dysthymia, and in conventional medicine, persistent fatigue might also be diagnosed as chronic fatigue syndrome. The encounter with a conflict tracked by meeting a certain person, being at a certain location, talking about a certain subject reinforces the manic or depressed mood or triggers recurring manic or depressive episodes. The weather or the season could even be a track. Therefore, some people become depressed when it rains or in late fall when the days get darker. In psychiatry, this is termed seasonal affective disorders. And seasonal depression has nothing to do with a vitamin D deficiency, as claimed, by the way. Next, let's discuss the connection between depression and the organs. Together with the manic or depressed mood, the biological special programs controlled from the temporal lobes also affect the corresponding organs. If a right-handed male with a normal hormone status has a territorial fear conflict, the same conflict impacts the bronchi relay controlled from the right temporal lobe. He is depressed as long as he is in the conflict active phase. When a left-handed person suffers a territorial fear conflict, the conflict manifests also in the larynx relay that is controlled from the left temporal lobe, and he is manic throughout conflict activity. During the healing phase, the right-handed male develops bronchitis and the left-handed male laryngitis. When a right-handed female has a sexual conflict, the conflict manifests also in the cervix and coronary veins relay controlled by the left temporal lobe. Throughout the conflict active phase, she has moderate angina pectoris, and mood-wise she is manic. For a left-handed woman with a normal hormone status, a sexual conflict impacts in the coronary arteries relay controlled from the right temporal lobe. During the conflict active phase, she has angina pectoris, but instead of being manic, she is depressed. After conflict resolution, the right-handed woman shows healing symptoms of the cervix, so vaginal discharge, and hormone replacement therapy changes the perception of a conflict. Hence, during the healing phase of a territorial loss conflict, the right-handed postmenopausal woman is at risk of having a heart attack and the left-handed woman of having a lung embolism. The same can be said about testosterone treatment for men. When an elderly man who is active with a sexual conflict is put on testosterone-enhancing medication, the right-handed male is at risk of having a lung embolism and the left-handed male of having a heart attack. Estrogen-suppressing medication has a similar effect. When a right-handed woman who is active with a sexual conflict starts taking the birth control pill, she is no longer able to experience the conflict from a female perspective, and as a result, the conflict goes into resolution and causes a pulmonary embolism. And this is why lung embolism is a frequent side effect of contraceptives. In a New Zealand study, it was reported that women taking oral contraceptives are nearly 10 times more likely to develop a PE than non-users. Failing to recognize the psyche-brain organ relation, conventional medicine considers the physical symptoms and the mood changes caused by the development of the depression as being entirely unrelated. The physical symptoms are treated by a physician, the depression by a psychologist or psychiatrist. What is commonly called a psychosomatic disorder is a vague diagnostic term since it refers only to general stress as the assumed causes of an illness. Theories suggesting that a depressed mood is the result of a lifestyle crisis that upsets the body, leading to an imbalanced blood sugar level, impaired thyroid function, a sick gut, and the like, are also missing the point. The physical symptoms related to a depression originate from very specific biological conflicts that correspond to very specific brain relays on the right temporal lobe. By applying the principle of gender, laterality, and hormone status, we are able to conclude from the physical and mental symptoms the type of conflict that causes a depression. This knowledge is also the starting point of the therapeutic approach. The significance of the biological handedness demonstrates that conflicts are primarily of a biological nature. that a right-handed female responds to a sexual conflict with ulceration in the cervix, a loss of estrogen production, and a manic mood, whereas a left-handed woman develops angina pectoris and a depression, wouldn't make any sense on a slowly psychological level. The fact that right-handers and left-handers respond to the same conflict with a different organ manifestation reveals the biological purpose of mania and depression. On the right temporal lobe, there are the control centers of several vital organs, including the bronchi, coronary arteries, bile ducts, and pancreatic ducts, with potentially serious complications during the healing phase. The depressed mood, however, stops a right-handed male and a left-handed female from resolving the conflict. In case of a territorial loss conflict, this prevents a heart attack that would occur during the healing phase. Moreover, a right-handed male with decreased estrogen levels, that is caused by the impact of the territorial conflict on the right temporal lobe, is, as a female, not inclined to resolve his territorial conflict. On the left temporal lobe, on the other hand, there are the control centers of the larynx, cervix, and coronary veins, rectum, and bladder, where, except for the biological special program of the coronary veins, there are much fewer risks and complications. Here, the manic state gives the left-handed male and right-handed female the necessary energy to resolve the conflict as soon as possible, which puts them into the ideal position to secure procreation in the event that unexpected territorial conflicts threaten the group or the pack. Let's also look at what causes manic depression. A manic depression develops with conflict activity involving both temporal lobes. With the impact of the second conflict in the opposite brain hemisphere, the person is in a temporal lobe constellation and manic depressive. In psychiatry, this is referred to as bipolar. A manic depression only occurs when both conflicts correspond to the temporal lobes with any conflict combination. So see here again postmortal constellation, Casanova constellation, Nympho constellation, aggressive, flying, myth, autistic, and marking constellations. Manic depressive means that the mood cycles between mania and depression, between manic episodes and depressive episodes, exist. And depending on the intensity of the conflicts, the condition ranges from mild mood swings to a severe psychosis. A lasting dominance of one of the two conflicts causes a persistent manic or depressed mood. And this, however, should not be confused with a primary mania or a primary depression that differ from a manic depression insofar as a manic depressive state is always accompanied by very specific mental symptoms and behaviors that are determined by the exact combination of conflicts, that is, by the particular constellation. And here we have the so-called scale rule. When the greater weight of conflict activity is on the left temporal lobe, the person is manic, and when the greater weight is on the right temporal lobe, the person is depressed. Stress and stimulants such as coffee or energy drinks, as well as medication and drugs with sympathogenic properties, reinforce a manic or depressed mood. Additional conflicts corresponding to the temporal lobes enhance the mania or depression significantly. What about psychotic attacks? Well, the tracks, so the associated events that were established when the conflict first occurred, amplify a current manic or depressed mood. Setting on a depression-related track deepens the depression. Setting on a mania-related track lifts the depression and heightens the mania. Hence, a manic track can be consciously used to get out of a depressed mood. Tracks and conflict relapses also reactivate a constellation after one of the two conflicts or both have been temporarily resolved. Essentially, a track, so a certain location, a person, a situation, a sound, an odor, is like an allergy prompting a reoccurrence of the manic or depressed mood and behaviors. Psychotic attacks with sudden emotional, mental, and behavioral changes happen when a strong biological conflict completes a constellation and when the conflict relapses, so the tracks occur. The encounter with a highly emotionally charged conflict track can throw a person instantly into a serious manic or depressed state. And here we find what is known as post-traumatic stress disorder also, where the person re-experiences the trauma through distressing memories of the event, accompanied by typical physical sympathicotonic symptoms such as nausea, excessive sweating, and a fast heart rate. When an additional conflict impacts the right or left temporal lobe, a moderate manic or depressive condition can become highly acute during the healing phase after one of the two conflicts or both have been resolved. Also, when a constellation is acute, it is better to downgrade a conflict rather than to aim for a complete conflict resolution immediately, because the constellation protects the individual. Downgrading the conflicts, for example through finding a partial resolution, reduces conflict intensity and the degree of distress. The objective here is to transform a hyperconstellation into a hypoconstellation. The main reason for this approach is to prevent complications that potentially arise during the healing phase, both on the conflict-related organs and on the brain level. And with this method, an acute psychosis subsides within 3 to 4 months. From a biological point of view, for a male with a normal hormone status, the first conflict can only be a male territorial conflict, so a territorial fear conflict, a territorial loss conflict, a territorial anger or marking conflict. If the male is right-handed, the conflict registers in the right temporal lobe. And when a right-handed man suffers a territorial loss conflict, for example the loss of his workplace, the conflict goes to the coronary arteries relay. Throughout conflict activity, he has a primary depression. With the impact of the conflict in the male conflict area, the testosterone level decreases and subsequently the estrogen level is relatively high. The second conflict manifests therefore just as a female conflict, as care-fright conflict, sexual conflict, identity conflict, or marking conflict. If he experiences, for instance, a sexual conflict, such as a sexual rejection, loss of a sexual mate, the conflict goes to the coronary veins relay in the temporal and the left temporal lobe. And with the second conflict, he becomes manic depressive and is in a so-called post-mortal constellation. What about postpartum depression? Well, like a biological special program that is initiated by a biological conflict, the pregnancy also progresses in two phases. A sympathicotonic phase followed by a vagotonic phase. During the first 3 months of the pregnancy, the woman is in sympathicothonia, and from the 4th month on until childbirth, she is in vagotonia. The vagotonic state of the expectant mother serves the purpose of preventing her from overexerting herself and putting herself and her baby in danger. The postpartum period begins immediately after the birth of the child. In conventional medicine, a postpartum depression is thought to be caused by the hormonal changes that occur after giving birth. If this were true, however, every woman in childbed would suffer from depression, which is certainly not the case. Based on modern knowledge, a postpartum depression, so a primary depression, only occurs when the pregnant woman has also experienced a territorial conflict during a gestation or during delivery. And because of a low estrogen status, a pregnant woman experiences conflicts in a male fashion. Such conflicts include territorial loss conflicts, so loss of a home, loss of the father of the child, loss of a family member or close friend, or territorial anger conflicts like anger at home or at work, arguments with the partner or spouse, difficult pregnancy or uncomfortable pregnancy examinations, or a territorial fear conflict such as fears of miscarriage, fears also about the healthy development of the baby. If a right-handed pregnant female has a territorial conflict during the first trimester, the conflict impacts in the right temporal lobe. And while she is in the conflict active phase, she is depressed, so she suffers from a primary depression. However, when she enters the fourth month, so the vagatonic phase, the depression stops. After the delivery of a child, the depression is reactivated provided the conflict is still an issue. If a right-handed pregnant female experiences a territorial conflict during the second or third trimester, the vagatonic state reduces the depression considerably. After she has given birth, the depression can, however, return. And we are going to finish this off by talking about natural means to help you with your depression. Based on the knowledge that we have gained during this presentation, the single realistic therapy of a depression or a manic depressive state of mind is first and foremost a resolution of the underlying conflict, whether they are territorial, sexual, or any of the other types of conflicts that we have discussed. However, often a downgrading of the primary depressive state is more preferable in order to avoid organic complications such as bronchitis, heart attack, embolic pulmonary events, and liver and pancreas distress, and many others. As the depression is also not a chemical brain imbalance, it does not need to be treated with chemical drugs such as antidepressants. To soften but not to suspend a depression and/or manic state of mind, it is best to use different plants which can beautifully elevate and improve the moods. Some of the plants that have an immune system boosting effect are ashwagandha, rhodiola, and astragalus. Other plants to harmonize the mind, body, and spirit, and one of the most preferred by us is the albizia flower. The bark and the flowers of the albizia juliebrissini are among the most valued Chinese botanicals for relieving anxiety, stress, and depression. It is traditionally known as the huanhua for the flowers, or the hehuanpi for the bark, or simply the happiness flower. The flowers and the bark are used as a calming sedative in Oriental medicine, and the bark is considered to anchor the spirit, while the flower the li. Albizia softens anxiety, depression, melancholy, amnesia, poor memory, irritability, angriness with gastric or chest pain, and insomnia, and is even more valuable than kava kava or St. John's wort, which also help. Albizia bark is also an extraordinary free radical scavenger. It penetrates the heart and liver meridians. The albizia flower enhances also the number of neurotransmitters, and it has also blood moving properties. And the active constituents of the albizia are saponins, tannins, flavonoids such as quercetin and isoquercetin. The bark is also great for treating external injuries, promoting blood circulation, reducing pain and swelling. It also promotes the regeneration of the flesh and bones. And you should consume between 3 and 15 grams daily, and stop, of course, the intake of toxic antidepressants you may take, and learn how to harmonize your mind, body, and spirit in a pleasant, holistic way. And this, of course, the means that we've depicted here and listed here are by no means exclusively so there are many more methods such as breathing exercises, meditation, etc. that can help you with your depression. If you have any questions about the subject, please do not hesitate to contact us 1-888-773-3196. Complete contact information in the description box below. Also, do not forget to take advantage of some of the most potent holistic health devices at amazing prices that can help you with your depression. Link in the description box below. If you've enjoyed this presentation, please also do not forget to like, share, and subscribe, and hit the notifications button so you don't miss out on the weekly holistic health content that appears on this channel. And with all that being said, stay healthy. Until next time.